OET 2.0 Occupational English Test. Today's topic, the listening topic, first one is gout. And listening part A, key skills. Once again, good evening. Welcome to Edu Skills OET Made Easy. Our mission is to make you fall in love with OET. I love OET is our dictum. And let's fall in love with the learning process of OET. Enjoy OET journey. And its English is not just for OET but for your life abroad. So let's be competent. And if you're watching this on YouTube, kindly consider subscribing the channel. Give us a thumbs up if you like our work. And please share the video link to your contacts so that we reach out to maximum number of OET aspirants, especially those who are financially struggling to crack OET. All the training programs at OET Edu Skills are free, and there is absolutely free, no charges at all. And on special requests from the beginners, we have started a Edu Skills English WhatsApp group, and you will get the links in the chat box as well. And you can join if you need the basic classes. Okay, that will be for basic classes, not only for OET. Any aspirants, IELTS, TOEFL, CBT, OSCE, or even professionals, other professionals, students, anyone can join. Your children also can join if they are ready to work. At least attend one session in a week. We will be step by step taking the basics of English. That will be something like simple sentence, basic structure, grammar part, step by step. So you can join that. That was on the request from many of the beginners. They wanted basic English lessons. There's another happy news from Edu Skills. Listening strategies, prediction or anticipation, which we'll be explaining after this session. Okay, beware of paraphrasing. Okay, most of the things will be paraphrased. You will have synonyms, synonymous language, and paraphrasing used in the question statement list audio. Beware of synonyms, beware of collective words. All those things, we'll come back to it. What should you listen now? What should you listen for? When you're listening to an audio, you should know what are you listening for. A couple of them we'll look into. First of all, you should listen for body parts. Do they speak about some hands, knees, some body parts? You should be listening to that. And listen to the adjectives about something they will say severe headache. Severe is the adjective. So quantifying or quality of a condition. And listen for names, medical conditions, medicine, such names. Here you will have mostly the name of a medical condition or a medicine. Yeah, symptoms. Listen for symptoms. Listen for negative expressions. Listen for sequence. Listen for cause and effect. Maybe impact of medicine. They will be speaking about the impact of medicine. So listen to that particular impact. And procedure. Some procedures mentioned. Listen to the procedure. Most of these things will appear as the answer. Infirmities or daily activities. Think of some challenges they are facing because of a particular medical condition. Are they able to do their daily activities? Are they able to go for job, work, or are they bedridden? Such things you have to listen. Then last one, presumptions. Presumptions means when a patient comes to the hospital, he will have a presumption. I may be having this jaundice, or I may be having something else. And even before diagnosis, the health professionals may have some presumption. Presumption means presume something, maybe this problem. Presumption can be from the family members, from the patient himself, from the family members, from the medical professionals. So those presumptions are very important. We'll be looking into it details later. Today we'll be looking into how to approach listening part A. And secondly, effective use of 30 golden seconds. I say 30 golden seconds, and much of your success depends on those 30 seconds. That's why I said they are golden seconds. Reading time before each audio. Third one, how to avoid unnecessary mistakes. We'll be looking into those things. Tips to understand your mistakes and to improve upon those mistakes. Listening text outline, I'm not going to detail it. I have already listening test outline. There's 3 parts, 42 questions. And B grade means 32 above correct answers. You are test ready, they say, but always we aim at grade A. Then you are safe around 380, 400. Otherwise, if you aim B grade, 32, when you are comfortable with the 32 or 33 score, probably you will end up with 310, 320, 330, 340. So never ever aim at grade B. Grade A is our target. So always target at grade A. And listening test outline, the first A part. Part A will have 2 consultations, 12 questions each. Okay, 15 minutes, 5 minutes each for each consultation. Okay, and 2 consultations and between a healthcare professional and a patient. Normally it is from between a healthcare professional, a GP or some healthcare nurse or somebody, and a patient, listening for specific details. Usually the answer comes from the mouth of the patient. Most of the answers will come from the audio by the patient, from the reply. The medical professional will be asking some questions. Those questions will help you or guide you to understand, to move on, because in the question booklet you will have those side headings which are hinting at the questions. Then complete the notes or sentences using a word or a short phrase. That's all you need to write in the gap space. Read the instructions given on the question booklet. Always read it, be thorough with it. Use the words exactly as it is given in the audio. Please don't paraphrase. Don't use your medical knowledge. Exactly you have to use what is said, given in the audio that you are listening to. Don't paraphrase or change the word forms. And introduction to listening part A, context statement about extract 1. There will be a context statement. Who is speaking to whom? Please listen. Don't listen to only questions, but here it's very, very important. Listen to the context audio which says who is speaking, which medical professional is speaking, and to whom, who is the patient. Okay, name of the patient will be mentioned there, and the profession or the designation of the healthcare professional will be mentioned in the context audio. See, occupational English listening test, those details are here. Then about part A, okay, introduction to listening part A looks like this. Okay, we'll come back to that. Now, let's listen that. Is it audible? Is it audible at YouTube? Please. At YouTube, if it is audible, please type in yes so that I know it's audible. Yes, yeah, okay, yes, well, yeah. Oh. Okay, we'll get back to that. This is what the introduction is. And who is, in the context, you will understand context statement about extract 1. Who is speaking to whom, name of the patient, professional designation of the healthcare professional. Then you have to foresee. In reading, you had first method, we have first method here, FILST method, which I will be explaining to you later. The same thing, foreseeing, investigation, listening, speaking out, and printing. 5 steps method, it's already there in the YouTube channel, OIT Education's YouTube channel. Foresee the vocabulary related to this particular profession or a condition. If they are speaking about a condition, just the vocabulary related to this condition. That whenever you practice, collect all those vocabulary belonging to one particular family or one particular profession or one particular condition. Types of situations connected to the profession or the condition. Okay, now here, what is the condition? Suffers from gout. Gout, yes. So gout is, what is gout? You know what is gout? Yeah? What is it? Who can tell me? In your own words. So that if there are some people who don't know what the meaning of gout, they will understand. It's sort of inflammatory arthritis, right? Inflammatory arthritis. So when you have this introductory statement, what you have to do? You have to ask, what is gout? Okay, which body part does it affect? Usually you have this problem in the joints, right? Uric acid. Okay, somebody, one life comments, yes, uric acid, yes. Inflammation of the toe, yes, inflammation of the toe or knee, any joints it could be. Mostly it is on toe and knees. So ask yourself, even immediately as the condition is mentioned, see Harry Davis, who suffers from gout. Ask what is gout and which body part of Davis does it affect? Okay, ask yourself, just presumption, it's only prediction. Okay, foreseeing. What are the risk factors? What are the risk factors? What do you know about gout treatment or medication? Do you know something? Do you know some medicines? And write down all these things in a big book, in a page. Okay, basic things. Then listening for questions. Now you see the first question, you will come to the audio. Now, first question, the health professional says, now Mr. Davis, I understand your GP has referred you to me so that we can review the medications you are taking for your gout. Review the medication. Now, medical history. So, well, tell me a bit about this gout. When did it start? This is the first question. Under medical history is the side heading. So, you have to ask when onset. When did it start? When did the onset? Why? Cause? What was the reason? How does he feel? Or how does it affect his life? Where, as I said, which part of the body is affected? So, open-ended question. This is also a clear, clean training for your speaking. These are the typical questions. Write down the questions and listen to the response. Those are the response the patient will give you. But these are the questions. For reading, you have to listen. For speaking subtests, you have to ask. Start it with the consultation with open-ended question. Open-ended question means they are free to speak anything. Closed-ended question means you can see that means Neha's shorts are going on about these things. Closed-ended questions means they can answer only yes or no. So these are open-ended questions. They can answer in detail. So these questions you can write down and preserve it and practice this for your speaking subtest. You can do it with your, maybe as you do a listening part A, that day you can, with your learning partner, you can make it a role play card and ask questions and answer. That will be great. Okay. So when, onset, why, cause or reason, how, feeling, or what is the effect, where, location, where which part of the body is affected, what, medication taken. Okay. You can ask these journalistic questions. We call it in the FILST method. Foreseeing, we said, what is gout, we will foresee. Then these questions we will ask, that is investigation, second step, investigation. So tell me a bit about this gout. When did it start? Treatment received. Okay. Under medical history, they are asking about this gout. Tell me about gout. So he will explain the details about his problem, his condition, how he is suffering from gout. Has he got some doubt whether it is gout or some other issue, and what medications did he take or something like that. Okay, treatment received. What was the treatment he received? Under that, there are two questions, right? So what have you been taking to deal with the pain? What answers you can expect there? You'll be asked about the treatment, earlier treatments, medication, some medicine's name, all those things. Third question, did you try any other sort of treatment apart from the medications? Did you try other medication, any other medication? Then again, the medication and what you call tablets, medicines, names will be the answers. Okay. Body parts. See, when you have, I said you have to listen for body parts. If at all a body part, paired body part is mentioned, for example, knees, shoulders, hands, when there are two body parts, eyes, such things, you have to listen to specific details, listen for specific information, where the right or the left or both are affected. My right hand is affected, or left hand is affected, or both the hands are affected. My right knee is affected, left knee is affected, or both the knees are affected, because in the answer you will have to write that specific information, otherwise it will not be right, unless the patient says which leg has the problem, you cannot treat the patient, right? So you need to say which leg has the problem. Okay, so this is the the text which we will have 30 minutes to read. Okay, just have a look at the text. I'll give you a better one. Yes, this is the text. You have 30 minutes now. Just if you have a hard copy, you underline whatever is important. Okay, if you want one more time, I will deal with that. Just have a look at, listen for body parts, adjectives, names of medical conditions, sickness, medicine, listen for symptoms, listen for negative expressions, listen for sequence, listen for impact of medications, cause and effect language of bills, and listen for some procedures carried out, listen for some infirmities or difficulties with the daily activities, listen for presumptions by the patient himself, by his family members, or by the physician or the health professional. Okay, so just try to see what could be. Could you just type in what is to be highlighted here? Medical history: suffers from gout, had his first serious attack while on holiday. Just look before and after the question, the gap. What is to be highlighted? Yeah, pain in his, which means what do you expect there? Type in the chat box. What do you expect? What answer? Yeah, pain in some body part. You have to listen. So this is what you have to do in 30 minutes golden second. Just highlight these things and concentrate on these things. So, pain in his hands, legs, back, or somewhere, some pain. And when it is gout, it's on the joints, right? And you said usually on the toe or knees or something like that. So listen for that. Then, initially thought it was either. Initially thought means sequence is there, at the same time presumption. Presumption by the patient. Initially I thought this is jaundice, but later on when they diagnosed, they said no, this is malaria. Okay, initially. So that's a sequence expression definitely. It was either. So you have to, what will be the answer? It will be medical condition. Second gap will be medical condition, thought something. Possibly related to medication taken for. Medication taken for. Yeah, for some medical condition. Maybe I was taking some medicine. This is the reaction for that medicine. Just imagine, see the flow of it. Okay, so third answer will be a medical condition. So you have to listen for a medical condition. Then describe the pain as. Describing. Yeah. Severity of the pain or something of that sort, which means adjective. There will be some adjective. Severe pain, horrible pain, awesome pain. You can't say awesome pain, right? Okay, irritating pain or pricking pain, whatever. So you have to listen what type of experience he is having. Then was unable to. This is very important. This is what I said. Yeah, this is what I said. Unable to means he is not able to do something. Some activity or some work, some job, or he is not able to do his duties, whatever. You have to find out able to, unable to. If you don't understand unable to, there is a negative expression. There will be something which they will mention he is able to do and something he is not able to do. So They are asking what is they are unable to do. Then again, you have that circular expression and suspected. Thought and suspected is same, right? Presumption, yeah. Says the clinic initially suspected. The medical health professional suspects another. What will be the answer in the sixth gap? Suspected? Yeah, medical condition. Yeah, medical condition. Yeah, reports previously feeling similar pain after. Pain after is important. Yeah, after doing something or after taking something or something of that sort. Okay. Then treatment received. Treatment received not effective. Cause and effect. Cause and effect. Some treatment was received which was not effective. Here they will play the game, effective and not effective. Okay. He mentioned, yeah, it's a beautiful game. If you really understand, it's a nice game. You can easily crack it. Now you see, there is a medicine mentioned here. Cause, you see, now here medicine is not mentioned, eighth gap. Now here they have mentioned here they say there was no effect. Okay, that is the cause. Here medicine is mentioned, but effect is not, impact is not mentioned. Okay, what is that medicine? Could you pronounce it? Colchicine. Colchicine. He was taking colchicine that caused something. Means there was some negative effect because of that. So you will be listening for that impact. As I said, listen for the impact of the medication. Then again, medication is not given, caused nausea. No, some medication he took and treatment, and that caused nausea. So you'll have to again look for medication. Then again, some medication quite effective. See, this is the game. Here not effective, here quite effective. So you may confuse between effective and not effective. And those two questions, 8 questions, you may write 11th answer and 11th question. You may think of this. So again, allopurinol. So another one medication is mentioned. Cause. See the beauty. Cause is to be answered. If medication is mentioned, cause is to be answered. Cause is mentioned, medication has to be answered. So just listen what all things he took. And see, that's it. One extract. So easy. So nice. Let's listen, okay? Try to write down and type in the answers. When you type in the answer, just type in one answer, number 1, this answer, okay? If you're able to type in fast. Otherwise, you can type in later. You can write down on your notebook. Okay? Are you ready? We'll see how nice it is. Ready to go? Yes. And effects at YouTube, I am waiting for the comments at YouTube. Side effect, they are still coming. Yes, ready. Yeah, number 1. Yes. Samia Ibrahim is waiting to answer number 1. She has already put the number 1 there. Type to number 1. And waiting, yes, father. Yes. Yasin, yes. Come on now. The audio will be on. Listen and answer. Okay, go with the audio. Yes. So interesting. Okay. Are you okay or you want to go one more time? Okay. One more time? Okay. Now when you go, try to write down the synonymous expressions. Okay. When they so not effective, they say something else. Okay. Try to write down the synonyms or synonymous expressions of what is highlighted here. Medication taken for something like that, or cost nausea. Okay. Quite effective cost. So just here you have to first you have to answer is some medicine, then not effective. They won't say not effective, but in the audio they have said something else. Try to write down that, and later you can type in as I ask you. Okay. Oh, beautiful. One life. Left knee, insect bite, cholesterol, excruciating. There is one spelling mistake. Okay, so don't worry, we will show you. Drive, septicemia, yes. Seventh one is not right, sprain, not sprain. Anti-inflammatory and diarrhea, awful diarrhea. They stress it there. Okay. Then 10th one, liquid morphine is good. 11th ice packs. Skin rash, yes. One life, great. On 11 are correct. Yes, wow. Yeah, yeah. Raji Taksila. Ms. Everest, I tell you, take patience, be cool, enjoy, and learn. And I will teach you all the tactics just to see that you do it like a game. Okay? Just like a computer game. Okay? All these tactics will help you. So your business now is to write down in your notebook. Then we can, later when I ask you, you can just post it in the comment space. Otherwise, you will not be able to concentrate when you type in maybe. So just write in what you hear instead of these highlighted things or any other additional synonyms or synonymous expressions, paraphrasing you find. Okay, shall we go one more time? It's a short audio. Yes, come on, listen with your listen with your smile. Listen with your smile. Yes. Yeah, we can do a lot of things. See, even that cold chain and all, they are not that he doesn't know, they are particular, specifically stopping for you. Cold chain, we are here. Okay? Cold chain. He says cold and stops and all that. Okay? And after pain, after rugby, you can just, there is time for your, this one break and have some snacks. Because until next question, when there is a side heading, normally there is a question from the health professional. Until health professional asks something, you can be very cool, enjoy, look around, relax, breathe in and breathe out, and ready for next game. Okay, take it in that spirit. Okay, that is clear. Now, give me some synonyms for any synonym. Type in your chat. Let me see. Synonymous expression or paraphrasing used. Yeah, pills for my cholesterol. Okay, I decided. For which word you will have to say, type in. It makes quite difficult. Different. Okay. 9, I can't understand. We are going into the analysis. Okay, don't worry. We are going to the analysis. Okay, Naima, Jamshad. We will be analyzing the whole thing. Don't worry. Full diarrhea. Okay. Yes. Let's check, and I will also be analyzing some of your answers, which you have sent me. I have got a screenshot, and I'll explain what mistakes you made. I could not take all, but your came first I took, and all will not be able to deal with today. So you have this highlighted text, right? Yes. Let me make a big screen. How nice, how enjoyable. Yes. See, these are the highlighted words which I kept highlighted. Okay, to make it very clear for you. Okay, now we will check out, analyze. Some have not understood. So now you see, listen for a body part. Pain in his body part. What was the body part? Left knee. Okay, I think at YouTube we have not reached with us, right? Okay, we will wait for a couple of seconds. YouTube is showing the previous screen. Come on, fast. You have to enjoy. Yes, you got it? YouTube, yes. Yeah. First highlighted thing is pain in his. When you hear pain in his, when you highlight that 30 golden seconds, there is nothing to do. Just see the words just before and after the gap. So listen for your body part. Pain in his body part. Thought it was presumption. What did he think about his condition? Possibly related to medication taken for. For which condition he has taken medication. Okay. So here again a conditionary name. Third one is a conditionary name, medication taken for some condition. Describes the pain as adjective and was unable to, infirmities or daily activity which he could not do. Okay. Condition name again. Says the clinic initially suspected, the health professional presumed or suspected, thought. Okay, those are the synonyms used. Then pain after, this has to be highlighted. Okay, similar pain after, sequence of events, after something, after some event, after playing rugby. Then treatment received, medicine name. First one will be medicine name. Then second one will be effect of medicine. Then again medicine name, then medicine name, then effect of medicine. Okay, those things will be the answers. How beautiful. See, this is one answer. I just exactly don't remember. I think Sonia Babu probably. Maybe you have also looked into corrected the answers probably after that. We'll look into this particular answer. Okay. Now you see, listen for a body part. Okay. In which part of the body do you experience pain? Normally you ask the patient, right? If he says, I have some pain, that's why I come to consult. You will ask, where do you have pain, right? There's a normal question anybody will ask. You may not be a health professional. Your mommy or dad or somebody at home will ask, I am feeling terrible pain. I'm feeling pain. Okay, they will ask you, right? That's a common thing. Yeah, very natural. So, see, it says body part left knee. I'm happy this Sonia Babu, I think she has learned skill strategies. So immediately she has written pain in the bracket body part, which shows they have understood the strategies. So listen only this first portion, okay? 3 answers. Left knee. So if you write only knee, answer is wrong, because that's the basic information required. This is a medical note, okay, that you are writing from the consultation. Imagine it's a medical note. So when somebody reads it, they should know this particular patient, even without seeing the patient, they should know which, sorry, please, left knee. Please at the YouTube, you can please at the Zoom, mute yourself. Left knee. So if you write, if there is a spelling mistake, N-E, if there is no double E, will it be right? No, because those are the common words, simple words. If you cannot spell simple words and some name of the conditions like blood pressure, diabetes, cholesterol, if you make a simple spelling mistake, one spelling mistake, you will get 0, no score. So beware of those things. Okay. So left knee is correct answer here of Sonia. Probably yes. Now second one is insect bite. Maybe the person has got a wrong answer, then corrected maybe. Insect bite. That was initially thought it was either insect bite. Initially thought means my presumption. My patient's presumption. Okay, we are not going to listen to it. Already we have listened, you know. I have kept the audio here, but it will take time. That is right. So is the answer is, you can write insect bite or an insect bite. Both will be right, okay? If you put something in bracket here, that means an insect bite is the right answer. And just without an insect bite is also right. You'll get the score. Okay. Now, next one is possibly related to medication taken for. And the audio says, my wife thought. My wife thought. That is wife's presumption. Okay, he's saying. So, answer is right or wrong. They have put right, but it's wrong answer. Why? Yeah, call us. One E is missing. This you will not get score. That's why I say some of them will say, some of you will say, oh, answers were very good. I have done everything correct. But here, such mistakes, you will lose the answer. That's why last 120 seconds are given to check your answers. Go through each answer. 120 seconds you have, right? So go through and find out if there is a mistake and write down these in your notebook, all these names of conditions and some medicines and all that appears in the test papers, that so that you are familiar. Otherwise, these are the simple mistakes, okay?
And now here, adjective, okay? Answer key, excruciating. And there are some meaning excruciating, some answers in the chat box. Okay, spelling mistakes will not be tolerated. So it is excruciating. Okay, and if you remember regarding pain and those things in my writing sessions, I have given all these possible answers like adjectives which can be used with pain and all that.
Fifth one, negative expression. Answer is drive, unable to drive. Okay, sixth one, time sequential expression, before. Something was suspected before diagnosing gout. Okay, the answer, it could be septicemia or septicemia, both spelling CAE or CE, both are considered right. No issues. So this answer is right. Okay, clinic's presumption. Says the clinic initially suspected. clinic. The health professional initially suspected some condition. So the presumption is how beautiful. So it is, answer is right. And seventh one. This is reports previously feeling similar pain after doing some previous history. Previous medical history, you say, in the writing subtest. So this is previous history. He is speaking about rugby. He says after playing rugby, he had this issue earlier. So answer is right. And treatment received. Then that's the answer for next question from the health professional. Anti-inflammatory. This is wrong. Why? Answer is wrong. This answer is a name of a medicine, right? So anti-inflammatories. You see plural. It must be plural. When many anti-inflammatories are given, saying anti-inflammatory misguides. So singular and plural. Next one, 9. Again, the effect of a medicine. Okay, and when they say they really stress there, awful diarrhea, right? They stress it there, the adjective. Awful diarrhea, even if you write diarrhea, that will be right. But it's always good to write awful diarrhea. Okay, and your answer is right. And next one, 10th one, name is medicine. Okay, liquid morphine. So that is right answer. Okay, and 11th one, procedure. Then the answer is ice pack. That is also right. Even an ice pack, both are right. 12th one, medicine. Effect of the medicine, impact of the medicine. And answer is a skin rash or skin rash, both are right. So now let's go to the script. Let's listen and read. Read along, okay? Audio, as you listen to the audio, read along and circle or underline or write down. Because multitasking, that's very, very important. Whatever, however you practice, you need multitasking. That's, you need to listen at the same time, read the question booklet, read the questions and the main highlighted words and all that. Then write, mark your answer. So you are doing multitasking. Listen, read and write. These 3 things you have to continuously practice. It's not going to be easy because you are not trained for that. Okay? So now, as you listen to the audio, read what is on the screen. At the same time, if you have a notebook, write down something, whatever important for answers.
Now, Mr. Davis,
Yeah.
I understand your GP has referred you to me so that we can review the medications you're taking for your gout.
That's right.
So, tell me a bit about this gout. When did it start?
Well, my first serious attack was last year. My wife and I were on holiday and I woke up one morning with a really bad pain in my left knee. Well, I never thought of gout because I always assume that just happens somewhere like your big toe, and anyway, I'm only 40. I thought it was something only old people get. So anyway, it was all red and swollen and I decided it must be an insect bite. But I couldn't think how that might have happened, you know, without me feeling something at the time. Or my wife suggested it might be something to do with the pills I take for my cholesterol.
Unlikely, I think.
But anyway, the pain didn't get any better. In fact, quite the opposite. I started to get frightened because I thought it might be a sign of something really serious. It was excruciating. So my wife thought I needed to get some help. So she phoned the local clinic and told them about my symptoms. They told her to bring me in. It was a good thing she was there. I was in too much pain to drive. I mean, I could only just manage to walk from the house to the car. Anyway, when we got there, the doctor took a look and said he wanted to take a blood sample. He said it might be an emergency because it looked as if it could be septicemia. So then we got really frightened. But about an hour later, they came back and said no, it wasn't, thankfully. But they thought I had gout. So actually, at that stage, we were quite relieved.
Yeah, I can imagine.
And the doctor asked if I'd ever felt anything like it before. Well, actually, then I remembered that in the winter, I play quite a bit of rugby and sometimes I'd get some soreness in the same place the day after, but I just thought I'd sprained it or something, and it would go away after a couple of days. But this pain's much worse, and it comes even when I've been resting. I've had it quite a few times since my first attack.
Right. So, what have you been taking to deal with the pain?
Well, at first the doctor at the clinic suggested I took some anti-inflammatories, but I can't say they made much difference. So when I got the next attack, I was at home and I went to my GP. She suggested I took, I can't remember the name, Col something?
Colchicine?
That's the one. So that dealt with the pain better, but it gave me awful diarrhea.
Yeah.
I'd never take it again. And then I had a really bad attack. I think the doctor had got to the stage where, you know, she was already giving me really powerful medicines to no effect. So she gave me liquid morphine to take. It made me feel quite sick, actually. And I was a little bit away with the fairies, you know, walking around not quite knowing where I was.
Right. Did you try any other sort of treatment apart from the medications?
Yes, my GP said I could try using an ice pack, and that did make a bit of difference, but you can't have it on all the time. So anyway, after that, she said, let's try allopurinol, see how you get on with that. So I started taking that, but I didn't get on with it. It gave me a skin rash, so I rang her up, and she told me to stop taking it, that I'd better see a specialist. So here I am. Is there anything more you can do?
Well, I'm sure we can find something, maybe a combination.
Okay, now, see, this is listening practice step by step. The sequence has to be like this. Step 1, do the test under exam conditions. If you are doing listening party, do it within 15 minutes. Okay, and the second step 2, refer the key and identify the mistakes. After doing under exam conditions, for example, now out of 24, you could answer only 18. Okay, that's cool. Well, then you see, maybe you can mark there 18, then rest of them you can do, no issues. But then your score will be considered under 18. Then when you check the key, you have 6 mistakes. So what is your score? 12. 18 minus 6. 12. Your score out of 24 is 12. So step 3, record your score on self-assessment form. EduSkills is applying in the main platform. You can see everyday posted self-assessment form, which is also posted with all the everyday task material. So record your score on self-assessment form. This is mainly for you to assess your improvement. At the same time, when you send me at the end, if you send me, whenever you ask me, should I take the date for exam, you have to send me the self-assessment form before that. Then I will look into your consistency, your practice, your score. Then I will tell you definitely you are ready for the exam. Step 4, listen to the audio again and try to identify the answers and related strategies. Okay, record your score. Now listen again. You have already seen the answers. Now you know the answers. Now listen to the audio again and try to identify the answers and related strategies. Okay, then step 5, listen to the audio plus read the script plus mark the answers and highlight the related strategies. Multitasking. Listen, read and mark means write. Okay. Step 6, detailed analysis of the audio and script to understand the strategies involved. Detailed analysis of the audio as well as script to understand the strategies involved. You can also, here I said, you can summarize using those expressions or paraphrasing or synonymous expressions given in the question booklet. Instead of this, then write down these synonyms and synonymous expressions, paraphrasing in your diary. Step 7, analytically listen to the same audio repeatedly for a week. Analytically listen to the same audio repeatedly for a week. Then you will understand, oh my goodness, they were so clear in their audio and I did not understand. Then you will understand certain accents you don't understand. You will be developing your competency in that.